My name is Chittivellu Subram. I'm the Program Director for the Pulmonary and Critical Care Medicine Fellowship Program here at Peoria, Illinois.
My name is Kelly Roth. I am a second-year Pulmonary Critical Care Fellow here at Peoria. An overview of the Pulmonary Critical Care Program here in Peoria would be that we have several different critical care units. There's cardiac, neuro, surgical, as well as the general medical ICU.
At present time, we have 4 fellows per year to a total of 12 fellows per year, including first, second, and third years.
On a day-to-day basis, it will kind of depend what rotation you're on. Typically in the critical care unit, we start our rounds around 7 o'clock in the morning, and we meet with the residents and have our multidisciplinary team with us.
We have 2 units, Medical ICU A and Medical ICU B, and 4 to 5 groups of internal medicine residents, emergency medicine residents, and pediatric residents will rotate through our ICU.
And everyone does have a very nice familiarity where we can talk to each other and get opinions on cases, and it's a very cordial environment.
We have 2 fellows will be in ICU every single day, covering Medical ICU 1 and 2. In addition, we cover pulmonary consultation service. We provide a service to coronary care unit, neurosurgical critical care unit, and step-down unit.
And there's a really robust outpatient clinic as well, where we take patients from many different rural communities as well as from the Peoria area.
Our block schedule for a first, second, and third years are such that you should be able to sit for a pulmonary board exams in the second year.
There's a lot of wonderful opportunities no matter what you're interested in, whether it's teaching or whether it be working in a community setting, and it's a really fantastic place to be. I would say the best part of the fellowship is the people I work with.
When it comes to the program, we have plenty of faculty members who are very dynamic and active in involving teaching, mentoring, and research.
So there are quite a few faculty here at Peoria. Some are newer, some are more experienced, so I think it's a great combination between the two.
All of our faculty members are board certified in pulmonary medicine, critical care medicine, sleep medicine, and some of them are also certified in neurocritical.
There are a lot of varied backgrounds as well, so we can get some different perspectives, and they're all very open to questions, and I feel very comfortable working with them.
I would boast all the time about our interventional pulmonary lab, which is headed by Dr. Witten. We do all sorts of procedures that could be bronchial thermoplasty for asthma, the valve placement for COPD, or pulmonary nodule biopsy with a navigational bronchoscopy, or endobronchial ultrasounds for patients with lymphadenopathy.
One thing I'm personally interested in is medical education, and there are so many opportunities to practice teaching at the bedside as well as through didactics with the medical school. We see a wide variety of pathology here in Peoria. We do have a large catch area in which we take care of rural patients. So we'll oftentimes get transfers to our ICU, seeing as we are level 1 trauma center. We have access to cardiac cath lab and a lot of interesting neurointerventional procedures as well.
So you will see a variety of cases in the clinic that could be COPD, interstitial lung disease, asthma, pulmonary nodules, pleural effusions, and bread and butter cases of dyspnea and cough.
In terms of our outpatient community, we see quite a bit of COPD and asthma, as well as some cancer patients and other obscure diseases such as fungal infections and some things that you may not see quite so commonly outside the Midwest.
So once you join the fellowship program, I guarantee that you will have a very good learning experience in our program.
So here in the jump simulation lab, we have a lot of great opportunities for learning. There's an ultrasound simulator in which you can practice the FAST exam as well as cardiac ultrasound. We also have the simulator for bronchoscopy where you can work on regular bronchoscopy as well as EBUS. And the surgical residents do also have quite a few interesting simulators as well. Peoria is a nice sized town. It's not very small in any means, but it's not quite as busy as somewhere like Chicago or St. Louis.
Peoria is a mid-sized city. Everything is like a 15 minutes away from the medical center.
What I really like to do is spend time outside, whether it's Saturday mornings at the farmer's market or walking through one of the many parks with my dogs. There's just a lot of activities that keep you engaged here in Peoria.